Let's proceed to combining points principles with the principle balancing left and right. The balancing of points on the left and right sides of the body is something that should be kept in mind when formulating a balanced point combination. There are two aspects to the question of balancing right and left sides when needling. The first is balancing the point combination in terms of left-right when treating a unilateral joint or channel problem. The second is the deliberate use of unilateral points to achieve specific effects. Balancing left and right when treating a unilateral problem. When treating a unilateral joint or channel problem, example, a unilateral neck ache or a unilateral elbow pain, with several points on the affected side, attention should be paid to balance left and right by adding 1 or 2 points on the opposite side. One can combine this approach with that of balancing yin and yang. For example, if you are treating a chronic left shoulder pain along the large intestine channel, we might use Li15, Li11, and Li4, all on the left. One way of balancing left and right might be to needle at lung 7 on the right side. This would achieve the effect of balancing left and right and also yin and yang. In some cases, we can balance left and right, yin and yang, and upper and lower. The same example of left shoulder pain using Li15, Li11, and Li4 all on the left, we might balance this with points on the left with liver 3 on the right. This achieves a balance of left and right, yin and yang, in upper and lower. Of course, one would not needle liver 3 simply to balance the points on the left, but it would be particularly indicated if the patient suffered from a liver disharmony. Now let's go to unilateral needling. Generally speaking, in the majority of cases, bilateral needling is the rule. Such a technique is adopted when a strong effect is needed. However, there are cases when unilateral needling is just as effective. Points can be needled unilaterally in order to balance the left and right sides. This technique obtains the same therapeutic effect using fewer needles, which is always a bonus, especially for nervous patients, those who are being treated for the first time, or those who have a severe deficiency of qi and blood. Even in other normal cases, reducing the number of needles used to minimum without compromising the therapeutic effect is a desirable goal. Unilateral needling, balancing a point on the left with another on the right side, can sometimes give even better results than bilateral needling. In particular, if the points balanced between left and right are also at the opposite ends, that is, one on the arm and the other on the leg, the effect is particularly dynamic. It is as if a pressure was applied along the tangent of a circle at the opposite ends, making it spin, as shown in the diagram on the right. So unilateral needling is usually used to move qi and blood, and bilateral needling to tonify qi and nourish blood or yin. Again, unilateral or crossover needling is usually used to move qi and blood, and bilateral needling to tonify qi and nourish blood and yin. Thank you for your attention.